The headliners, the newsmakers, the political scene, and government issues. These should be our concern, and we're taking you at the forefront. Good morning. I am Attorney Karen Jimeno. Join me at the forefront as we zero in and discuss the details of some of the most pressing national issues that our country faces. The Department of Health reported yesterday that nationwide cases of leptospirosis increased by 17% in the last 2 weeks. Contaminated floodwaters brought about by the monsoon rains and by Typhoon Carina were pointed out as the main cause for this problem. Most patients suffering from the bacterial blood infection have been trooping to San Lazaro Hospital and the National Kidney Transplant Institute. Are the resources of the DOH capable of effectively responding to this epidemic? Joining us today is the Assistant Secretary and Spokesman of the Department of Health, Assistant Secretary Albert Domingo. Good morning, ASEC Albert.
Good morning, Attorney Karen. Thank you for inviting the DOH to your show.
Thank you for being here today, ASEC. So let's start first. For those who are not familiar with leptospirosis, can you tell us what this, is it a disease, an infection? Can you help us understand what leptospirosis is?
Yes, Attorney Karen. Leptospirosis is a disease caused by the bacteria called leptospira. These are spirochetes or spiral-formed bacteria, which are often found in the urine of rats. There will be also some other animals like livestock, but more commonly, especially in our setting, they are found in the urine of rats. This is very important because when we talk about how leptospirosis is transmitted, it goes through floodwaters. Your rats might actually urinate in garbage piles, which is why solid waste management is important. And when the floodwaters rise, no matter how fast the flow, as long as there's flood, it will pick up the urine of rats, and this could actually come in contact with the skin of your legs. And this is where the bacteria goes into your bloodstream and affects your organs like your kidneys, your brain, your liver, and other sites of the body.
Okay, so you started off with a very scientific explanation, but if we were to reduce this in layman's terms, it's really bacteria from the urine of rats or other animals. And then it's that bacteria that comes into contact with people that causes the disease. If, for example, you wade in floodwaters and you don't have a wound, you know, you just really wade, that's still a risk that you might get leptospirosis?
It is, Attorney Karen. In fact, when we evaluate patients for leptospirosis, you have low risk, moderate risk, and high risk. Low risk is someone who may not have an open wound that is visible to the eye, but still comes in contact with floodwater. Why? Because you could actually have what you call microabrasions or small wounds, paper cuts. Maybe you had your manicure or you have an ingrown toenail that could actually be an opening in your nails, in your skin, where the bacteria from the urine of rats can cross over into your bloodstream. For those at moderate risk, these would be people who have a visible wound or maybe a healing wound, and then the wound comes into contact with the floodwater. So that's a logical explanation that the bacteria will find it easier to enter your body. The high-risk leptospirosis patients would be those living in areas or maybe working in flood-prone areas like rescue personnel or street sweepers, street cleaners, where their exposure to floodwaters is more often than once a day because they keep coming back to that area.
Okay, so it is really a risk for anyone, even if you don't have a visible wound.
Yes.
How serious is leptospirosis? What are the symptoms?
It is very serious, but I'd like to highlight at this onset that leptospirosis has an incubation period, meaning the time it takes for symptoms to appear. The incubation period can range from as short as 2 days to as long as 30 days. On average, Attorney Karen, you will actually see this in the clinics around 7 to 14 days. If we talk about what's happening to our Metro Manila right now, we are seeing a lot of cases right on the dot, 2 weeks after Super Typhoon Carina and the strong southwest monsoon hit our area and resulted in a lot of flooding. So that incubation period is, runs at 7 to 14 days. It has symptoms like fever, Actually, most of the patients complain of anuria, which is a medical term that means no urine. There is no urine that forms. There will be 1 to 2 days. Some patients, kids actually saying, Mom, Dad, I'm not feeling well. I haven't urinated for the past 24 hours, which causes the parents to bring them to the emergency room, typically the National Kidney Transplant Institute, but this early I wanted to say that's not the only hospital that can handle it.
Okay, so this is good that you're telling us what the symptoms are, so that if people hear about this and think, okay, I think I have one of the symptoms, what should they do? Should they immediately go to the hospital?
Yeah, so there will be other symptoms, by the way. You can also have typically body pains, particularly at the calf area, or in Filipino, alak-alakan, so the calf area. Then that would also be signs of it. You could have yellowing of the eyes. You could have a change in the color of your urine and stool. And these, I really have to emphasize, these will appear at a somewhat midpoint or later stage of the disease. Because for the first few days, 7 to 14 days, you will not feel anything. And the key public health message here, Attorney Karen, is as long as you waded in floodwaters, you have to see a doctor to get your prophylactic antibiotic.
So there is a way to prevent it. So,
yes.
Okay, if you have no choice but to wade in floodwaters, because we saw this during Typhoon Carina. If you were traveling at that time, you might have been caught in flood and had no choice but to wade in floodwaters. So immediately, if you are forced to wade in floodwaters, what should you do?
So if you are forced to wade in floodwaters and you have no other choice, within 24 hours, it is best that you already, of course, after you come from the floodwaters, dry yourself, change your clothes and your footwear, wash your body, especially the parts that were dipped in the floodwaters, wash them with clean water and a bath soap, and consult a doctor within 24 to 48 hours, 1 to 2 days after you're wading in floodwaters. That will allow you, the soap will kill any residual bacteria that is on your skin. But remember, there might have been a few that made their way into your bloodstream. So you still need to consult a doctor, and the doctor, upon evaluation, may prescribe for you what you call doxycycline. A quick note, Attorney Karen, doxycycline is not for everyone. Pregnant women and the children 12 years old and younger should not take doxycycline. There are other antibiotics for them. Okay,
so especially for children, just bring them to a doctor so you can be properly advised as to what to take. Okay, and it seems like a lot of people that were infected with leptospirosis went to San Lazaro Hospital and then the Kidney Transplant Institute. Why specifically the Kidney Transplant Institute?
It's probably linked to the main symptom of anuria, the absence of urine. So imagine if you're a parent or if you're a loved one and then you notice that your housemate, your family member complains, I'm not having any urine for the past how many days already, or maybe how many hours, I haven't urinated, or there's a pain in the abdomen. So typically, your instinct would be, you have a problem with urine, you probably have a problem with your kidneys. And because the name of the hospital is National Kidney and Transplant Institute, it's very logical for all patients to assume that you have to go there. Which is why the DOH has always been emphasizing these past few days, NKTI is not the only hospital capable of handling kidney patients. There are also many other hospitals with dialysis machines, and these are all available for use. What is important is they first call the hotline of the DOH, I'll give you the number later, so that they can be navigated to the vacant beds.
Okay, so any regular hospital is a place you can go to. When you said that, okay, within 24 hours of wading in floodwaters, go see a doctor, it can be in any hospital.
Yeah, in fact, Attorney Karen, the one that I said within 24 to 48 hours, if you don't have symptoms, it doesn't have to be at the hospital. You can go to a government health center, a rural health unit, or in the city, a city health center, and you will have doctors there. You do not need to be confined. The nice thing about prophylaxis is you are not feeling any symptoms yet, and that when you are given the antibiotic, you can take this at the comfort of your home without being admitted to the hospital, and it brings down the risk of hospitalization.
Okay, so you really just need that prescription and get that expert advice.
That is correct.
So the 17% increase in leptospirosis in the past 2 weeks, that seems like a very alarming rate. Is this considered a national health emergency?
That's even a low number.
That's a low
Yes, that
number.
is a low number.
You mean that's an underestimate?
It's not an underestimate, so let me explain why. The data which we released, the 17% increase coming from the previous weeks, that is what you call epidemiologic data, meaning this has been verified, the doctors are sure that these are cases of leptospirosis. But in the past 4 days, from August 8 to August 12, we are seeing operational data, meaning in the hospitals, we are seeing a lot of patients. This is what has been reported at the news, that you have San Lazaro being filled up, the NKTI. Let me just glance to my papers because it's actually fresh. You're the second program this morning to actually air this. As of August 12, a total of 471 leptospirosis cases have been reported to DOH hospitals. So that's 471, not yet part of the count that we released a day or two earlier. Out of those 471 cases, 372 or almost 80% are adult. Then around 99 or 21% are kids. 6 cases are on mechanical ventilators. An overwhelming 197 or roughly 42% are undergoing hemodialysis. And a total of 20 deaths have been reported, 13 adults and 7 kids.
Oh my gosh, so that's already, how much would you know roughly the percentage that brings the cases to?
So these 471 cases are what you call clinical cases and still pending epidemiologic validation. So it's a very early point right now to conclude the percentages. But Karen, Attorney Karen, the key message here is it's going up. And it's connected to floods. And the next time, what's Carina? Letter C. We know that Pag-asa uses the alphabet, and we know that from our experience, we actually almost reach Z, if not reach Z. So there are many other weather disturbances that will bring a lot of rain and a lot of flood. So we need to be cautious in the next few days. We can handle it. The thing is, we just need to be aware. I'd just like to discuss another point. You mentioned that there are people who have no choice but to wade. But unfortunately, there are also people who swim,
yes,
who actually jump, backflip.
And they really enjoy it. So actually,
exactly.
That was my next question. I wanted to ask that specific point. So there are others who have no choice. I'm in that category. That's why I was
yes.
so curious. What should I do if I have to wade in floodwaters? But for those who really do it because they find it enjoyable or they find it to be recreational, what is the Department of Health going to do about that? Are you going to coordinate with the LGUs? How do you intend to address that issue?
So first off, let me be clear. We might be irritated. We are irritated. But as doctors, we are sworn to treat everyone. We're not going to judge you whether or not you had a choice or not. We will still treat you. But from a public health perspective, even before the rains come, this deserves a lot of attention. Last Monday, Secretary Orbosa said in public that he does plan to encourage local government units to pass ordinances so that this would be prevented, this would be banned, outlawed. What am I speaking of? Swimming in floodwaters. You actually saw, you will see, up to now, it's still playing on social media, on TikTok, on Facebook, wherever, on Reels, on Instagram. People enjoying the floods, having memes, some even drinking, which is also bad. Drinking is bad. But while they are submerged half-body in floodwaters. Attorney Karen, floodwaters are dirty. And in public health, if you can prevent something from happening, that's the best approach. When we see patients lined up at the hospital, that's already a symptom of an earlier upstream problem, which means there could be behavioral issues like people swimming. So the good news is that was Monday. Secretary Ted said he would advocate for this. On Tuesday, San Juan City Mayor and Metro Manila Chair Presiding Officer Francis Zamora said, yes, he supports the call and he is going to discuss with the Metro Manila Council, all Metro Manila mayors, this proposal for them to perhaps have their own localized ordinances prohibiting swimming or having fun in floodwaters.
Okay, I think that might be a good way to address this. And in terms of the cost, so that people understand really how serious this is, Around how much does it cost to treat leptospirosis in a private hospital?
That's a very good question. The prices in private hospitals do vary, of course, depending on the hospital. I don't have the exact numbers now, even in public, but I'm pretty sure a dialysis session, for example, let's talk dialysis. The current PhilHealth rate for dialysis is already at 4,000 per session. And yet, that's a different issue. We can have a whole episode of that. But to sum it all up, 4,000 is not yet enough. You have hospitals saying it runs from around 5,000 to 6,000. Let's just use 5 to make it easy to compute. So at 5,000 per session, and if you are in acute renal failure, you will have to undergo dialysis maybe 2 to 3 times in a week. While you are being treated, the course of treatment for antibiotics can range from as low as 5 days to as much as maybe 10 or 15 days, depending on how long the treatment course is. So if you use 10 as a convenient number, and 5,000 pesos per session times 3 times a day. So what's that? 15,000 times 10 days. Your rough minimum or average is 150,000 for a treatment. I'm not even counting the hospital services, the medicines. So this is so much more expensive than actually not swimming, not having fun in floods, or if you do happen to wade, just consult. You get free consultation, free doxycycline. You will not spend this much.
But the free consultation, free doxycycline is in a public hospital.
That's correct. It's in a public hospital. And there were also a few well-meaning private sector doctors who were offering telemedicine consultations for free.
And the doxycycline, how much is that per tablet?
Oh, that's a good question. Doxycycline capsules range in price from 1 peso to 128. Yes, it's a very big range. It's very affordable. But more importantly, when the state of calamity, a state of calamity was declared in Metro Manila last July 24, the Price Act empowers us, the DOH, to release a list of medicines for price freeze. And doxycycline is part of that list. So the prevailing price for doxycycline, the range is cheapest one, most expensive 128. You cannot bring that higher than what it was last July 24, at least for the next 60 days. Counting up to September 23, roughly.
And the dosage, in order for that prophylaxis to work, is how many tablets?
So if you are moderate risk or high risk, let's start with moderate risk. Low risk, you probably won't be asked to take it. But if you're moderate risk, you just have to take 2 capsules of 100 milligrams each once. And then that's it. So it's really very convenient. It's very easy. The key here is to change our population behavior that if you do wade in floodwaters or you swam, you waded, please consult your doctor within 24 to 48 hours, even without symptoms.
Okay. Do you think, ASEC Albert, the Philippine healthcare system is capable of handling this type of epidemic? But before you answer that question, we'll have to go on a short break. At the Forefront, we'll be right back. Welcome back at the Forefront. ASEC Albert, before the break, we were asking you, do you think the Philippine healthcare system is capable of handling the leptospirosis problem?
Yes, our healthcare system learned a lot from the pandemic. I would say, why am I comparing it to the pandemic? COVID-19, which is very fresh to our memories, it's actually more contagious. It's airborne, it's harder to manage, and you need a lot of ICU beds, no? Compared to leptospirosis. In leptospirosis, from a medical perspective, the limiting step here in terms of health system resources would be your dialysis machines, to some extent ICU beds, but more of the dialysis machines. So, and also, you cannot transmit leptospirosis from human to human. I mean, I'll make it sound absurd, but we don't wade in our own urine, because that would be how to transmit it. So, those premises being considered, it's actually easier to manage leptospirosis from a healthcare system perspective. We just have to be careful when it comes to allocating beds. Especially now, so we saw in the news that NKTI, San Lazaro almost became overloaded. Thankfully, there are well-meaning organizations like the Philippine Red Cross, in addition to DOH hospitals, who would share nurses, doctors, human resources across each other so that we can actually alleviate the pressure on our system. But if worse comes to worst, we can actually expand. When you say expand, for example, if your average hospital has 100 beds and before a crisis, only 10 beds would be assigned to leptospirosis, you could have what you call surge capacity, which increases the number of beds allocated for leptospirosis.
And you mentioned earlier that, of course, getting prophylaxis treatment is the cheapest and best way to address this because it's preventive. Recently, actor Gerald Anderson trended on social media because he was trying to buy
I thought he was on a jet ski. No.
Okay. Oh, no. Okay. He was trying to buy the doxycycline, which is the prophylactic medicine. But he, I think, said that there was a shortage. Well, he was asking where he could buy that medicine after waiting in the flood. But there was a shortage of this medicine at the height of the flooding and Typhoon Carina. So do you think this was something that the DOH could have foreseen, considering that, one, we get early warnings when there's a low pressure area or a typhoon coming? And how does the DOH plan to address this issue of supply?
That's correct, which is the reason why, Attorney Karen, July 24 was when Carina hit. On the same day, 1 million doses were immediately released nationwide. Focus was given, of course, to 4 regions, if I remember correctly, National Capital Region, Region 4A, Region 3, and Region 1. These are the 4 regions which were hardest hit by Carina. And in fact, in the DOH language, they were placed on what we call Code Blue. So the doxycycline capsules, the free capsules, were immediately distributed, and these are actually available at our government health centers. To bring us to the current date, so 2 weeks after, July 24, we looked at the stock levels. We did notice that there are actually a few low-level stocks in these same 4 regions, and replenishment capsules are on their way. In fact, if we released 1 million capsules before July 24, there are 500,000, 500,000 capsules waiting to be released. The papers are just being processed, but they're on their way.
Okay, so supply is not an issue.
Yes.
If I were to go to a health center and ask for doxycycline as something that I want to stock at home in order to make sure I have access to it, is that something that I would be allowed to do?
You need to have a prescription. So this is the reason why the prescription is very important. The main reason for a prescription is, of course, the patient's health. As I mentioned, there are contraindications. Pregnant women cannot take doxycycline. Young kids, younger than 12, cannot take doxycycline. But also, you have another issue, which is called antimicrobial resistance. If we stock up on doxycycline and take it without any prescription, which means it's not medically indicated, we run the risk of training. Yes, training. Our Olympians are here. The bacteria can also become Olympians. When I say this, if you give them antibiotics at the wrong dose, you're actually training them to become stronger. And that's going to be a problem. We don't want that. That's why we are strict with the prescriptions, but it's actually easy to get the prescription. And then the third reason for the prescription is to somehow manage the supply. We do not want our kababayans to stockpile if you do not need. By the way, doxycycline has an expiry date. So it's also not good to store medicines that you're not going to use that will just be expired later anyway. It's best to keep them where they are at drugstores or at health centers where people who need them with prescriptions will get them, will buy them, and then they get easily replenished later on by fresh stocks.
So in that case, when Gerald Anderson was asking on social media where he can buy medicine for leptospirosis, he can't just go to a drugstore and buy that medicine, that doxycycline.
I am hoping that he had a prescription when he was doing that, because if he did not have a prescription and was going to the drugstores on his own, he wouldn't be given doxycycline.
Are there any other types of treatments that are more like homeopathic, or meaning, for example, if you don't have immediate access to doxycycline, what can you do to prevent the symptoms, or at least perhaps prolong before the occurrence of the symptoms?
So we have to be reminded of the causative agent. This is a bacteria, leptospira bacteria, and the real solution is an antibiotic. Alternative therapies will just mask the reality that the infection is going on. And they might actually give a false sense of security that you think you're improving, but if the leptospira are not addressed by the correct antibiotic on time, you might have less symptoms, your fever might go down, but your kidneys are also shutting down, and if it hits your brain, you're going to be in the ICU.
Mm-hmm. Well, the other cause of this problem, it's not just the flooding, but what you said earlier is also, of course, the trash. So this is a waste management problem. How is the Department of Health addressing this issue in relation to, you know, the other agencies responsible for trash management, waste management?
This is where it gets very interesting. A lot of our diseases have what you call social determinants. Health itself has many social determinants. It's, some of these include education, your occupation, your access to transportation, solid waste management. Let's focus on leptospirosis. With the right solid waste management, we can bring down rat populations. Why are we talking about rat populations? Because leptospirosis is vector-borne. In public health, if you say vector, the vector is the animal that but actually brings with it the causative agent that affects us humans. In dengue, the vector is a mosquito. In leptospirosis, the vector is a rat. And how do we keep vermin? How do you keep rats at bay? They thrive on garbage, wasted food, a lot of solid matter that they eat up. They probably live in sewers, in tons of piles of garbage. If we are able to manage our solid waste efficiently and effectively, we can also bring down rat populations. And remember, they urinate everywhere. So if we eliminate garbage from our homes or from our cities properly, then we will lessen the chances that the urine of the rats will cause leptospirosis when there will be floods.
Well, we already know that Philippines experiences floods all the time. And considering this epidemic is occurring again, is there really no long-term solution that, you know, the DOH has been pursuing? So recently, former DOH Secretary Garin, Janet Garin, was saying that there was a lapse in terms of how the current Department of Health leadership addressed the leptospirosis problem. What is your opinion on this issue?
Well, when it comes to solving this problem, as I mentioned, there are social determinants of health. You're actually asking the right questions. And I was wondering if there is a guest from DPWH, from MMDA. These are agencies that we need to work with together to change, also the Department of Education, to change behaviors. The kids who are swimming, no matter how often you warn them, and we did warn them a lot of times when the storm was hitting a few days later, even up to now, this program, thank you so much, is actually helping warn our population that you should not be swimming in floodwaters. However, it takes time to change behaviors. It takes time to change cultures. In fact, I would even say 5 years is not enough. 10 years could be. So the question is, 10 years ago, what was the Department of Health doing together with the Department of Education, etc., so that this future problem of 2024 would no longer happen? And Secretary Urbosa is doing his best so that the future Secretary of Health 10 years from now hopefully will not have this problem or maybe have a lesser version of it.
Asik Albert, are you aware of the past data on this leptospirosis occurrence? Like, for example, in the past years, did it reach a level of like double digits every time there's a typhoon in terms of the cases of leptospirosis?
Attorney Karen, the closest situation that we did have before was Ondoy in 2009. Similar situation. In fact, it could have been worse back then because the floods then lasted for, if I'm not mistaken, 3 or 4 days. So, well, the floods did last for quite a while now, but I don't think it reached around the 3 to 4 days this time. So yes, there were a lot of cases way back in 2009. Hospitals were also overloaded. I was a young doctor at the time. My colleagues were in residency training, and they did tell me just a few days ago that they have a bit of post-traumatic stress disorder. They are reminded of how it was managing the situation back then. So we did learn a few lessons when it comes to medical management and public health management. But again, it goes back to the earlier question you had on the social determinants of health, because unless we actually do something about education, about solid waste management, about flood control, then these things will just keep on happening in the future.
So as it stands right now, leptospirosis is an epidemic in the country. But how serious should it get before the government declares a national health emergency? But before you answer that question, Asik Albert.
Excited.
Yes, we'll take a short break. At the forefront, we'll be right back. Welcome back at the forefront. Asik Albert, we were discussing earlier. So as it now stands, leptospirosis is an epidemic in the Philippines. But at what level should it get before it can be declared as a, what do you call it, like a public health emergency?
Yes.
Or what the proper term is for this?
So, Attorney Karen, to begin, I wouldn't say that it is an epidemic of national proportions, and I'll explain why. The term epidemic or outbreak, that's another synonym of epidemic, means that the number of cases has exceeded a comparable a number in a comparable situation, typically the previous year, for a specific locality. So, I would say that at this point, it is alarming because the numbers are high. But there are formal requisites before we can declare an epidemic, and it's important to declare an epidemic on a localized basis. Let me explain. Republic Act 11332, or the short name is the Notifiable Diseases Law, it's the governing law that tells us who gets to declare if there is a state of public health emergency, who gets to declare if there is an epidemic. There's a separate law, the RA number escapes me now, but I think this is the National or the Disaster Risk Management Act. That,
RA 10121.
There you go. Yeah. Thank you, Attorney. And that is what empowers LGUs to declare a state of calamity. So you have three terms: public health emergency, epidemic, and state of calamity. Let's go through them one by one. Beginning with the state of calamity. A state of calamity is not necessarily due to a health concern. There could be other reasons, war, well, that's extreme, maybe infrastructure problems or a typhoon, state of calamity. And to our simple understanding as non-lawyers in the department, this is a mechanism that allows local governments to access funds faster, quick reaction of funds. So, a state of calamity, as heavy as it sounds for the news cycle, doesn't necessarily mean there's a problem in terms of health. Now, what about outbreaks and epidemics? The reason why the same law I mentioned, RA 11332, Section 7 in particular, empowers local government units to make the declaration themselves is because risk communication is very important when it comes to disaster or public health emergency response. Let me explain further. Imagine if the DOH, yours truly as spokesperson, started announcing that LGU-A, LGU-B has an outbreak, and then the provincial government is not aware or maybe has a delay of knowing and has not prepared. It would result in a communications breakdown because people would be, of course, irritated at each other, which will also impair coordination when it comes to the response. Whereas, as the law says, if it is the local chief executive who declares, then everything would be ready. Once they declare that there is an outbreak, then this is the response. We are able to move this amount of resources, this amount of people, ready our hospitals, and so on. The last point I wanted to mention, so who gets to declare a state of public health emergency nationwide? That's where the Secretary of Health comes in, but it's not the Secretary of Health who does so, it's the President of the Philippines. The last time we did this was in COVID-19, when former President Duterte, on recommendation of the Secretary of Health, who was part of the interagency task force, based on scientific data, said, yes, we have a problem nationwide. So that's the only time that the DOH will say that there is a national epidemic. So every time I am asked now, Attorney Karen, our response is by law, it is actually the local government chief executive who should be declaring outbreaks. As I think Quezon City is saying that they have hotspots for dengue, there are a few other localities that have taken it upon themselves invoking this authority to declare outbreaks of dengue in their particular areas.
Okay, so this is really helpful, very helpful, ASEC Albert, because one, we now understand this leptospirosis has not reached the level of an epidemic or there's no nationally. And again, we understand the process of when this declares and what that means when it is declared as an epidemic or even a national health emergency. Thank you so much for your time today. It has really been truly insightful.
Thank you so much, Attorney Karen. Always happy to help out, especially when it comes to health information.
Thank you. While there are insinuations that the Department of Health has committed lapses in preparing for the spread of leptospirosis, it is clear that the improper waste management combined with floodwaters are the culprit of the epidemic. Nonetheless, the Department of Health is doing its best to address the issue head-on, confident that the Philippine health system is capable of surviving an epidemic which is not as challenging as the COVID-19 pandemic. Be timely informed, be insightful of the news. Always stay at the forefront. Join us again tomorrow for meaningful conversations. This is Attorney Karen Jimeno. Thank you for spending your hour with us.